I'm Barbara Spivak, and I'm an internist in Watertown, Massachusetts. I've been practicing for about 30 years.
Dr. Spivak is on her way to an appointment, but it isn't a house call. It's to speak to a large group of people, which is not easy for her.
I hate getting up and talking in front of people.
And now I'd like to introduce Dr. Barbara Spivak.
I used to quiver and shake when I had to get up in front of people and talk.
She's been with the program from its very beginning.
But she's doing it anyway, because she feels strongly about what she's about to say to this group of people.
Dr. Barbara Spivak.
Thank you for having me.
What do these people all have in common? They are seniors covered by a Medicare Advantage health plan, and they're concerned.
When you join straight Medicare, patients are really left on their own to manage their care and take care of things themselves.
Because their Medicare Advantage plans are in danger of being cut or even canceled.
When you belong to a program like the Tufts Medicare Preferred program, you really join a network and a system of care that coordinates everything.
It's taken a long time to get to this point. Meet Carol. She is living proof of the difference between Medicare and Medicare Advantage.
That person started in my practice before they chose the Medicare Advantage program.
Good, how are you? Good, what are you seeing today?
She got heart failure and breast cancer. She was sometimes just so tired she couldn't coordinate the ride that she needed to get to her regular doctor's appointments. So eventually, after a day or two or a week, she would feel so badly she would have to call the ambulance, get taken to the hospital. So this kind of cycling event happened over and over again.
Doctor's ready for you. Hey, how you doing today? Good.
That cycle is bad for the patient, bad for the doctor, and extremely expensive.
Good.
It's also increasingly the norm.
She's here for a routine checkup today?
Absolutely.
Traditional Medicare doesn't even pay for a physical exam beyond the first time when you turn 65. And as people get older, patients see several different specialists and are on so many drugs. To figure out how to do that and do it right and get to all your appointments can be very complicated. When she was in the hospital, she would have one case manager. And that case manager was also helpful in making sure that she got to all her appointments, helped her set up her rides. How you doing today?
Good.
How's everything going?
When Carol enrolled in a Medicare Advantage program, at first it was simply because it costs less.
Purely because it was cheaper to go into a Tufts Medicare Advantage program, we were able to get several things. Take some deep breaths. One, a nurse practitioner came in to see her, and a case manager would call in the morning and say, you have to be up and dressed, the ride is coming, and help facilitate the appointment. In a very short period of time, she stopped being hospitalized. The cycle totally was broken. Staying off the coffee?
One a day.
And she's not alone.
Our data shows that our emergency room use is less, our hospitalization rate is less, our patients get better screening. Now that you're better, doing this kind of screening is going to save your life in the long run.
I know you have a lot of questions out there.
But in the name of reform, some want to vote Medicare Advantage out of existence.
Is there any discussion in Washington of a single-payer health plan?
What's being done in Washington to help promote freedom of choice for seniors?
Most of these Medicare Advantage participants want to know the same thing. What would happen if Medicare Advantage simply went away?
I think the most critical thing is that all of their supports would disappear, and the patients will go back to getting virtually the isolated care where they come to the doctor, they're told to do 10 things, and they have to figure out how to get to those 10 things on their own.
not to mention increasing costs for patients and for the taxpayer.
Have a good day.
That's why Dr. Spivak is here.
I would never in my wildest dreams be able to have done that without the help of the team of people who went in there to help this devoted family.
Dr. Spivak still doesn't make house calls, but if she can help these people to keep their Medicare Advantage plans, this visit could be worth all the house calls in the world.
I actually believe that all of Medicare should be transformed in various ways into some kind of a Medicare Advantage program, a coordinated care program.
And as for public speaking,
I'm a little better now that I don't quake, but when I was asked, I do believe so much that what we do is really a lot better, that I felt I had to come out and talk about it.
Thank you, Dr. Spivak.